Hello, and welcome to the first lecture of DSUR 1128, Introduction to the Oral Cavity. I'm Tanya Chamberlain from the Division of Anatomy, and in this lecture we are going to look at the skull and the surface anatomy. But that is limiting what we're actually going to be looking at, because we have so much more to cover. This lecture is designed to be used alongside your workbook provided to ensure that you are fully engaging with the material. This lecture covers section 1 of the workbook. I will not be marking these books, these are for your benefit only, but please be aware that anatomy can rarely be studied passively, so this workbook will help you in your learning process. In this lecture, and after further study, we should cover these learning objectives. They are listed in the front of your workbook to help focus you at the task in hand. I will break this lecture down into 3 parts that correspond with parts A, B and C within your workbook, or in the different coloured slides throughout the lecture. First of all though, let's dissect the bony bits of the head and take apart the skull. These images should be fairly common. On the left, we have an anterior view of the skull. That is, we are looking at the skull from the front. The right of this skull is actually here. I know this can seem confusing because I'm pointing at the left-hand side of the picture, but when thinking about the anatomy, we are thinking about the patient's anatomy. So this patient's here is on the right-hand side. Likewise, this is the left-hand side of the skull. On this image to the right, we have a lateral perspective of the skull. That means we are looking at the skull from the side. This side of the skull is the anterior side, and this is the posterior side. So this is the front of the skull, and this is the back. The skull is a story of 2 halves. We have the viscerocranium, which is covered in pink. The viscerocranium describes the skull bones that form the face, whereas the neurocranium is made up of the bones that house the brain. All of the bones of the skull, except for the ear bones, the hyoid and the mandible, articulate via sutures. That means that they are connected by sutures. Sutures are a fancy way of saying that the bones have fused together. A lot of these bones are fused before a fetus is born, but there are some bones of the neurocranium that don't completely fuse until 18 months after birth. You may know this as a fontanelle. Let's just try and collate some of the key points about the skull. The skull is made up of 22 bones. Most of these are paired, i.e. they're formed in twos. They articulate, connect, except for the mandible, via sutures that are completely fused when we are about 18 months old. The viscerocranium describes the facial bones. And finally, the neurocranium describes the bones that house our brain. So let's move on and look at the viscerocranium first. The first bone we are going to look at is the one that dominates our face, the maxilla. The maxilla forms the upper jaw and contains the teeth of the roof of our mouth. It can be quite difficult to visualise the 3D aspect of the maxilla, so let's swap on to our photogrammetry to look at the maxilla in 3D. This model represents the left maxilla. The maxilla is one of the very many paired bones of the skull. We are currently looking at the maxilla from an anterior view. If I turn the model to the left, we can see it from a lateral perspective. And if I turn the model to the right, we can see it from a medial perspective. The maxilla runs from the floor of your orbit, your eye socket, and travels inferiorly to your teeth. Also, the maxilla we could see from an inferior perspective, forms the roof part of our mouth. If you run your tongue behind your front teeth, you are rubbing the maxillary bones of your face. We can see that there is a rough area here. This is called the zygomatic process, where the next bone, the zygomatic bone, joins to. These two zygomatic bones, as seen here, are the bones we associate as cheekbones. They form the lateral wall of your orbit and the apples of your cheeks. You can feel these bones comfortably if you draw your fingers down from the outside corners of your eyes and then across to the level of your ear. On this photogrammetry, the yellow bone, labelled 1 and 3, is the zygomatic bone. Label 4 is the zygomatic arch. And if I rotate this to look more inferiorly, we can see that this arch of a bone leaves a nice space to accommodate for the coronoid process of the mandible. Let's have a little break now and look at a couple of the less complicated bones of the viscerocranium. The small nasal bones are situated at the level of your upper eyelid. They do not extend all the way down to the bridge of the nose to the tip. This is cartilage, but you can gently palpate these bones if you press either side of your nose between your upper and lower eyelids. The lacrimal bones form the medial walls of the orbit and should not be attempted to palpate, as you would be rubbing the inner corners of your eye. The lacrimal bones are very small and very fragile. It has a small channel that allows the collection of tears during excessive lacrimation, aka crying, like when you're trying to learn the bones of the skull. The mandible is our next pit stop on our collection of viscerocranial bones. The mandible is another name for the lower jaw, and this is not a paired bone. It houses our lower teeth and plays a pivotal role in mastication, i.e. the act of chewing. Because of its important role, it's necessary to take a closer look at the mandible. Here are two images of the mandible. This one shows a lateral perspective. We are looking at the mandible from the outside. So this surface would be in contact with our cheek and chin. The other image is showing the exact same section of mandible, but from a medial perspective. This surface here would be the part of the mandible in contact with our tongue. The first part of the mandible to identify is the condylar process. This is the part of the mandible that articulates with the neurocranium, the temporal bone, to produce the joint that allows us to open and close our jaw. This hook is called the coronoid process that provides an attachment site for some of the muscles of mastication. The ramus of the mandible is this area here. And just below that, we also have the angle of the mandible. Everything anterior to this is known as the body of the mandible. We also have the mandibular notch up here, and this oblique line down here. We also have the very first of our many foramen on the face. Foramen simply means hole. Foramina are normally for the passage of blood vessels and nerves, and this one is no exception. Likewise, the other foramina of interest is this one on the medial surface, the mandibular foramen. We have this little lip, the bony lip of lingula here, the myeloid line and the pterygoid fovea, both of which form attachments for muscles. So that was quite a lot to take in. So let's go back to a nice simple bone identification. For the next bones, we need to dissect our lateral skull. We have performed a sagittal cut, meaning we have cut down the centre of the face between the eyes, down the middle of the nose and through the middle of the chin. So on this image, we are looking at a medial view of the sagittal cut. The brain would sit here, and the right eye would sit behind here. The bones we are going to look at are the nasal concha and form the lateral walls of the nasal cavity. We can see these bones here from the anterior. These bones are only just visible through the nasal aperture. And sagittally, we can see the right nasal concha forming the lateral wall of the nasal cavity. We can also see another bone from the anterior and sagittal view. This one is called the vomer, an unpaired bone that divides the nasal cavity into left and right halves. We need to adapt to another view of the skull now in order to see the bones that form the dorsal aspect of the hard palate. The image on the right we are now familiar with, but with the image on the left, this is an inferior view of the skull, having had the mandible removed. We can see the teeth of the maxilla along here. So these are our upper teeth, and we can see the zygomatic arches coming down here. So these are the ones that form the bridge of our cheekbones. The palatine bones are viewed here. If you move your tongue or run your thumb over the roof of your mouth, you can feel the hard bones of the maxilla. If you move further back, be careful not to gag. You can feel the edge of these bones as you begin to palpate the soft palate. These palatine bones are forming this edge and they divide the oral cavity into the hard and soft palates. This is where we'll end our journey of the viscerocranium and move on to the neurocranium. The first bone to consider is the frontal bone. This largely makes up what we know as our forehead. It also forms the superior wall or the roof of our orbit. Infrolaterally, it's articulated with the zygomatic bone, and posteriorly it articulates with the parietal bones. The frontal bone is an unpaired bone, and this bone in particular is quite thick and sturdy to protect the brain from injury. It also articulates with the nasal and maxillary bones anteriorly, and on its lateral edge it articulates with the sphenoid bone, which we will discuss in a few minutes. The parietal bones are here. These paired bones meet along the top of the head at the midline and are fused along the parietal suture, also known as a sagittal suture, which even the kids' Halloween skeletons seem to represent. These bones are also thick and protect the top of the brain from injury. These bones articulate, as discussed, with the frontal bone, but they also articulate posteriorly with the occipital bone. Laterally, they meet with the sphenoid and the temporal bones. Where the sphenoid, temporal and parietal bones join is the weakest part of the skull. This is known as the pterion. Just under this runs the middle cerebral artery, and consequently an injury to this area can have huge consequences in the form of a subarachnoid hemorrhage. This image shows the temporal bones, the bone that protects the brain from areas around the ear. This bone can be divided into two regions. The anterior part is described as the temporal area, whilst the posterior part, behind the external acoustic meatus, is described as the mastoid area, and we can see that we have this mastoid process down here and the styloid process coming just in front. This next bone will require us to look at the skull from yet another angle. If we focused on the lateral image on the right, we are going to cut the calvaria, the skull cap, off and look down into the cavity. To orient you further, the nose would be here, the eyes here, the ears here, and the back of the head is here. This shows the occipital bone that forms the majority of the posterior cranial fossa. So this is the area where most of the posterior brain and the cerebellum will sit. This bone has a huge hole in it, called the foramen magnum, which allows the medulla of the brainstem and the spinal cord to exit the cranial cavity and move down into the spinal column. Thankfully, there are only 2 more bones we're interested in today, for which we'll move on to now. The first one is the ethmoid bone. This unpaired bone allows nerves involved in olfaction, that means smell, to transmit information to the brain. It's quite a fragile bone and susceptible to damage resulting from a blow to the face such as boxing or in a car crash. In such circumstances, it can be possible to severely damage the olfactory nerve and produce anosmia, which is a loss of smell, in the unfortunate patient. Our last bone is quite a complex and yet a very significant bone. This is the sphenoid. This large bone is somewhat shaped like a butterfly, which we'll look at in a minute. And although it's considered anatomically to be part of the neurocranium, it forms a bridge between the neurocranium and the viscerocranium. We can see in this image it articulates with the temporal, frontal, zygomatic bones, but on this image we can also see that it articulates anteriorly with the palatine bones too. Those are here. It also forms a small part of the anterior and the middle cranial fossa. In order to get more of appreciation for the sphenoid, let's have a look at its photogrammetry. We are looking at the sphenoid from a posterior aspect, so we're looking at it from the back of the sphenoid. And this is why you'll remember I said this bone reminds me of a butterfly. We have the body here, and the lesser and greater wings of the sphenoid bone here. This bone has a number of holes in it for the passage of cranial nerves to the appropriate organ systems. These holes are the optic canals that allow for passage of the optic nerve for recording images that our eyes see. We also have these large fissures here. These allow for the passage of the first branch of the trigeminal nerve, the ophthalmic nerve, which is used to control the muscles of the eye. We have foramen rotundum under here, which transmits the passage of the maxillary branch of the trigeminal nerve, so our second branch. And finally, we have foramen ovale here, which transmits the mandibular branch of our trigeminal nerve. So let's have a recap and go over some key points. The skull is made up of 22 bones, not including the iliad or hyoid, and most of these bones are paired. They articulate via sutures, except from the mandible, which has a fibrocartilage joint. The skull can be divided into 2 regions: the viscerocranium, which are the facial bones, and the neurocranium, which house the brain. Let's have a recap of today's outcomes. And the next one we're going to look at is the oral cavity. Here we will explore the oral cavity and what we see when we look into someone's mouth. So this image displays a nice set of teeth. We could see the incisors at the front, the canines, the premolars and some of the molars at the back. But sometimes what we can't see is just as important as what we can see when it comes to anatomy. So we also need to describe the spaces in the mouth too. The first space we are going to address is the vestibule. This is the space within the side of the mouth between the teeth and the cheeks, or specifically the buccal region. This can further be divided as to whether we are talking about the superior or the maxillary vestibule, or the inferior, the mandibular vestibule. The mouth is also home to some folds of tissue. The first one we are going to look at is the mandibular buccal frenum, which is a fold of oral mucosa between the mandible and the buccal region. We have one of these on the left and on the right. We also have a superior version of this, as seen here, and a matching one on this side too. This is the maxillary buccal frenum, which bridges the buccal region and the maxilla. Another space of interest is this crevice between the lips and the gum, where the lips join the oral mucosa of the maxilla or mandible. In anatomy, we like to call crevices sulci, and this is the labial sulci. We have a superior one, called the maxillary labial sulcus, as indicated here, and we also have an inferior one, or mandibular labial sulcus, down here. And finally, from this image, we have another fold, this time between the maxilla and the lips. So this one is called maxillary labial frenum. This is an image from the underside of a tongue. We have the mandibular teeth, and the tongue, and the lips. It's likely you'll have seen this deep purple vein in your own mouths when looking in the mirror. This is the deep lingual vein. We also have a fold underneath the tongue, referred to as the frenulum. This, when excessively tight, is known as being tongue-tied, and babies in the UK are routinely screened shortly after birth for a tongue tie, as it can be difficult to roll the tongue for creating a vacuum for breast or bottle feeding. Not exactly super clear on this picture, but there are also two sublingual folds. These are folds that extend, as the name suggests, under the tongue. Further folds are visible here on the ventral surface of the tongue. These are plicae fimbriata that run along the ventral aspect of either side of the tongue and can sometimes be adorned with small triangular flaps of skin on their course. At the base of the frenulum, there are two little holes where the sublingual salivary glands ducts open into the mouth. These are called sublingual papilla. These two pictures of the tongue. Anatomically, the tongue is divided into 1/3 posterior and 2/3 anterior, and these two regions are separated by the sulcus terminalis. This division will become relevant when we start looking at innervation of the tongue. When we consider the oral cavity, we are particularly interested in the soft and hard palate of the cavity, which can be seen in this image. We are looking at the palate from the inferior view, and here are the maxillary teeth, with the maxilla and the palatine bones. This is the maxilla, and these are the palatine bones. During the formation of the face in utero, there can be a miscommunication in growth. in which these bones can fail to fuse correctly, and this can lead us to developing a type of facial cleft. There are numerous facial clefts, but the one we are going to look at briefly is called a cleft lip and palate. Here we have 4 different babies born with a range of cleft lip and palates. The first one is what would be described as an incomplete unilateral cleft lip. This is because it does not completely extend into the nostril. And it's called unilateral because it's only on one side, in this case, the left side. My own son was born with this, but his is on the right side. In some babies, there is a gum and palate involvement, but a lot of the incomplete unilateral cleft lip malformations do not have any further involvement. Picture B shows a wider, complete unilateral cleft lip. We can also see by the lack of gum line that there is palate involvement too, indicated by the dark shadow. Picture C shows us the inside of the mouth of a baby born with a bilateral cleft lip. From the looks of this image, we have one side which is complete, as it extends into the nostril, but it is unclear as to whether it is complete on the other side also. We can also see here how there is a palate cleft too. This is where the hard palate has failed to fuse. It is very likely that the soft palate will also have failed, but it is difficult to see because of the position of the tongue. These fuse at a similar time in utero, so it's likely that if the hard palate has a hole in it, so does the soft. In the final picture of the last child, a complete hard and soft palate can be seen, in which we could see right up into the nasal cavity of the child. I can attest to the fantastic skill of the multidisciplinary team for repairing these clefts, as they are often repaired within the first 4 to 9 months of life outside the womb, with follow-up procedures as necessary, although they are largely cosmetic. We are now ready to move on to look at the anatomy of the neck, where we will look at the triangles of the neck and the surface look at the larynx, thyroid, sternocleidomastoid and the carotid arteries. We will also look at the pulse points of the head and neck. We are looking at an anterolateral image of the left side of the neck, but thankfully this can be mirrored to look at the right too. But for the sake of clarity, we have stretched the neck out by raising the head and pointing it slightly towards the patient's right. The neck can be crudely divided into triangles, and each triangle is bordered by different muscles and has different contents within it. We have an anterior triangle, as indicated in this image, which describes the space towards the anterior of the neck. This is bordered by this large 2-headed muscle here, called the sternocleidomastoid. This is a large muscle running either side of your neck, from the mastoid process of your temporal bone to the front part of your clavicle and most superior part of the sternum, hence its name, sternocleidomastoid. The superior border of the anterior triangle is the inferior border of the mandible. The triangle on the image represents one half, so this image is mirrored to the other side, with no discernible border between the two halves, although some texts may argue that the midline separates the left from the right. We will move on to look at the triangles within the anterior triangle in a short while, but first let's have a look at the posterior triangle. We have 2 of these triangles, as they definitely do not meet in the midline. The triangle is bordered anteriorly by the sternocleidomastoid, posteriorly by the trapezius muscle, and inferiorly the triangle is enclosed by the clavicle. So let's move back to the anterior triangle and dissect this further to reveal the triangles located within the anterior triangle. The first one is the submandibular triangle. This triangle's superior border is the inferior border of the mandible. With the anterior border being formed by the anterior belly of the digastric muscle, and the posterior border being formed by the posterior belly of the digastric muscle, and the stylohyoid, which runs alongside it, although it is not seen in this image. Because of its borders, some texts will refer to this as the digastric triangle. The roof of this triangle is formed from superficial cervical fascia, which is a sheet of cells that help prevent the sticking of muscles to each other. And it's also covered by the platysma muscle, which is a large sheet of muscle down either side of the neck that helps to keep the skin taut. Inside this triangle, we have the facial artery and vein, which would run across here. We would also have the submental vein and artery, the submandibular salivary glands, the lingual nerve, the hypoglossal nerve, and the middle pharyngeal constrictor, with some submandibular lymph nodes. The next triangle within the anterior triangle is this one. This is the carotid triangle. Its posterior boundary is the sternocleidomastoid. The superior boundary is that of the posterior digastric belly, and the anterior boundary is formed from the omohyoid muscle. As indicated by its name, the carotid artery lives here, along with a few other structures. We have the facial artery and the lingual artery, along with a few other arteries travelling to the face and head. A very important nerve, the hypoglossal nerve, which innervates the muscles of the tongue, also lives in this space. We also have the internal jugular vein, which runs alongside the carotid artery. The carotid artery and internal jugular vein sit inside a sheath formed by some fascia called the carotid sheath. In this sheath, we also have the super important nerve from the autonomic nervous system, the vagus nerve. This nerve is very important for the regulation of heartbeat and the digestive system. The last subdivision of the anterior triangle we are going to look at today is the muscular triangle. This has the sternocleidomastoid forming the posterior boundary, the omohyoid forming the superior boundary, and the sternohyoid forming the anterior boundary. This muscular triangle contains the thyrohyoid muscles, the sternothyroid, omohyoid, and sternohyoid muscles, which are very important for controlling the larynx when swollen. This concludes the main regions of the anterior triangle of the neck. So let's move on and look at the posterior triangle of the neck and the two triangles that sit within it. The first one is the occipital triangle, bounded by the sternocleidomastoid again, but also the omohyoid and the trapezius. Within this triangle, we will find the brachial plexus, which is a collection of nerves that control the arm and some of the muscles of the thorax. The cervical plexus, which innervates the muscles of the neck and shoulders, and a couple of veins and arteries travelling to the occipital region within the back of the neck. Our final destination is this small triangle here. This is the omoclavicular triangle. And again, the appearance of the sternocleidomastoid muscle bounds the anterior with the clavicle and the omohyoid binding the inferior and superior borders of the triangle. This triangle has a large artery running through it, called the subclavian artery, and the external jugular vein and the brachial plexus can also be found in here, as can the phrenic nerve, which is the nerve that controls our diaphragm for breathing. All that's left to look at is the neck from the anterior position, as can be seen in this image. Here, on this image, we can see the two heads of the sternocleidomastoid muscle, one running down the right, as indicated here, and one running down the patient's left. We can also see the subclavian arteries poking out, just under here, within the omoclavicular triangle, as discussed in the previous image. These two long arteries are the common carotid arteries that bifurcate into the internal carotid artery, which moves to the brain, and the external carotid artery, which focuses more on the structures of the face and head. We have one on the left and one on the right. These bifurcate at roughly the level of the Adam's apple. So the Adam's apple can be a good landmark when assessing blood supply to the head and the neck. This is where the common carotid artery splits into the two branches. In these images, we can also see the relationship of the larynx, hyoid, and thyroid glands. These are partly obstructed by the sternocleidomastoid, so the image on the right better represents the surface anatomy of these structures. The thyroid gland overlies the larynx and part of the trachea, fanning out either side beneath the sternocleidomastoid, a few centimetres above the sternal notch, which is here, and you can feel this on your own body. The hyoid bone sits just superior to the larynx and provides an anchor point for the muscles that attach to the hyoid and the larynx, allowing the raising of the larynx during swallowing to prevent the aspiration of food and drink. There are a few pulse points in your head and neck. These are found when the artery is near the surface of the skin, which is quite unusual with most our anatomy, as the arteries are normally kept hidden away from the skin because of the risk of damage. But as the head and neck is so compact, there are a few regions in which the artery comes close to the surface. The first one is the carotid pulse, which can be found on the lateral aspects of the neck within the carotid triangle. We can also feel a pulse on the inferior border of the mandible. This is the facial pulse, transmitted by the facial artery. We can feel this as it crosses the inferior border of the mandible as it leaves the submandibular triangle. We have one in the temporal region, which is from the superficial temporal artery, and one which comes from an anterior branch of the superficial temporal artery, slightly closer towards the eye. So to summarise, we have looked at the divisions of the neck, including the triangles of the neck, and we have briefly outlined the borders and the contents of those triangles. The anterior triangle contains a vast array of veins and arteries, whilst the posterior triangle also contains a huge collection of nerve plexuses which go on to power the muscles of the neck, the arm and the chest. We have also looked at the bifurcation of the carotid level with the Adam's apple and the location of the thyroid gland, larynx and hyoid. Use the information acquired in this video and work through the first section of your workbook to help consolidate your knowledge.